You've seen 4 different doctors this year. Your blood work came back normal. Your primary care doctor said it might be stress. The rheumatologist ran one test, didn't love the number, and told you to come back in 6 months. Your dentist just told you that you have 3 new cavities, and you haven't changed your diet at all. Nobody is lying to you. But nobody is connecting the dots either. Here's the uncomfortable truth. Sjogren's disease takes an average of almost 3 years to diagnose, and for a lot of people, it's closer to 5 or 6. Not because it's rare. It's actually the second most common autoimmune rheumatic disease there is. It's because it doesn't show up as one big red flag. It shows up as a dozen small ones, scattered across a dozen different specialists, none of whom are looking at the whole picture. So today, you're not going to wait for someone else to notice. You're going to learn how to notice first. By the end of this video, you're going to know exactly which small, unrelated symptoms are actually clues, how to lay them out like a detective lays out a case file, and how to walk into your next doctor's appointment with something no one can wave off as just stress, or just getting older. Because here's the thing, you're not crazy. You're not dramatic. You're not making it up. You're just early. And early is exactly where you want to be. Before we continue, I built something specifically for this, not just for tracking, but for your next doctor's appointment. It is called the Symptom Map, and it walks you through exactly which symptoms to track and how to bring them into the room with you. Type the word map below and I'll send you the link directly. Let's start here, because I think you need to hear it before anything else. If you've been dismissed, minimized, or told it's probably just anxiety, that's not a reflection of what's actually happening in your body. It's a reflection of how hard this disease is to catch with a single test or a single visit. Most people with Sjogren's don't walk into urgent care with one dramatic symptom. They walk around for years with a slow accumulation of things that seem unrelated on paper. Dry eyes that they chalk up to allergies or screen time. A dry mouth they blame on their medication or dehydration. Fatigue they blame on being a parent, or a shift worker, or just getting older. Joint aches they blame on their mattress. A weird, foggy feeling in their brain they're almost embarrassed to describe out loud. Individually, every single one of those is easy to explain away. That's exactly the problem. Sjogren's doesn't hide because it's subtle, it hides because it's scattered. And most medical visits are built to look at one system at a time. Your eye doctor looks at your eyes. Your dentist looks at your teeth. Your GP looks at your labs. Nobody's job, in a normal 15-minute appointment, is to lay every single one of those threads side by side. That's going to be your job. And it's not as hard as it sounds. Comment heard if you want these 5 categories laid out for you in one document instead of having to remember them from a video. Here's the mindset shift. A good detective doesn't wait for a confession. A good detective builds a case out of small pieces of evidence that, alone, mean nothing, but together, tell an unmistakable story. You are going to build a case file. Not a vague list of I don't feel good. An actual, organized set of clues, sorted into categories, tracked over time, ready to hand to a doctor who will finally have no choice but to look at the whole picture instead of one piece of it. There are 5 categories of clues you're going to hunt for. Let's go through them one at a time, and I want you to actually notice, as I describe each one, whether it's ringing a bell. That instinct? That's not a coincidence. That's your body, trying to tell you something it's been trying to tell you for a while. CLUE 1, the dryness pattern, fear and recognition. The first category is dryness, and I want to be specific, because dry eyes undersells what's actually happening. This isn't ordinary dryness. It's a gritty, sandy feeling, like there's something actually stuck under your eyelid, that artificial tears barely touch. It's waking up with your eyes almost glued shut. It's a dry mouth so persistent that you keep water by the bed, that makes it hard to swallow crackers without washing them down, that started quietly rotting your teeth from the inside, cavities showing up in a mouth that never had them before, despite nothing changing about your diet or your brushing. Here's the clue most people miss completely. Dryness doesn't stop at your eyes and mouth. It can show up as a dry, hoarse voice by the end of the day. A persistent dry cough that no inhaler seems to touch. Dryness in the nose, the skin, and, if you feel comfortable tracking this one, vaginal dryness that shows up well before menopause would explain it. Write these down. Not dry eyes, sometimes. Write down how often. Write down what you've tried. Write down whether it's gotten worse over the last year. That specificity is what turns "I've been a little dry lately" which any doctor can wave away, into documented, progressive dryness across 4 separate mucous membranes, which is a lot harder to ignore. Comment pattern if you've noticed. Clue 2. The fatigue that doesn't make sense. The second clue is a specific kind of exhaustion, and if you've felt this, you already know it's different from being tired. This is fatigue that doesn't improve with sleep. You can get 9 hours and still feel like you're moving through wet concrete. It's a fatigue that hits in waves, sometimes worse after you've pushed yourself even a little. It's the kind of tired that makes people around you start to wonder if you're just out of shape, or not trying hard enough, and that's one of the cruelest parts of this disease, because you know it isn't that. You know something underneath it is actually depleted. This matters as a clue because autoimmune fatigue has a signature. It's disproportionate to your activity level, it doesn't respond to rest the way normal tiredness does, and it often travels with brain fog, trouble finding words, losing your train of thought mid-sentence, feeling like you're operating at 60% even on a good day. Track it on a simple scale. 1 to 10, once a day, for 2 weeks. That's it. A pattern of consistent 5 to 8 fatigue that doesn't track with how much you slept is a real, objective data point, not a feeling, a pattern. If your fatigue feels tangled up with brain fog and nobody's connected the two, comment tired. Clue 3. The body-wide symptoms nobody connects. This is where it gets interesting, because this is the category most people, and, frankly, most doctors outside of rheumatology, don't automatically connect to a dry eye and dry mouth condition. Joint pain and stiffness that moves around, sometimes symmetrical, often worse in the morning. Numbness or tingling in the hands or feet, that a doctor might initially chase as a pinched nerve. A racing heart or lightheadedness when you stand up too fast, which has its own name, POTS, and shows up far more often in Sjogren's patients than most people realize. Digestive issues that get labeled IBS. Unexplained skin sensitivity to the sun. Swollen, tender glands along the jawline, just in front of the ears, the salivary glands, flaring under the surface. Here's the thing that makes this section a detective clue rather than just a list of symptoms. It's not any one of these. It's the combination. A joint pain diagnosis alone means very little. A racing heart alone gets written off as anxiety. But dryness, plus fatigue, plus 2 or more of these body-wide symptoms, appearing together and persisting for months? That's a pattern specific enough to name. I want to pause here and name something directly, because I think it's the single most validating thing in this entire video. If you've collected a folder of other diagnoses before anyone said the word Sjogrens, that's not a coincidence. That's actually the most common way this disease reveals itself. Think about the labels that tend to show up first. Chronic dry eye syndrome from the optometrist, treated in isolation. IBS from the gastroenterologist, because the digestive symptoms didn't come with an obvious cause. Fibromyalgia or chronic fatigue syndrome, because the fatigue and body aches didn't show up on standard blood work. Anxiety or somatic symptom disorder, because the doctor ran out of other explanations and the symptoms didn't fit anything they were specifically screening for. Sometimes even early menopause, because dryness and fatigue got attributed to hormones alone. None of those diagnoses are necessarily wrong on their own terms. Some people really do have IBS, or fibromyalgia, or anxiety, entirely separate from anything autoimmune. But when you start lining up the dates on these diagnoses next to each other, a different picture can emerge. 3 or 4 separate conditions, all showing up within the same 2 or 3 year window, all sharing an unexplained root of inflammation and dryness underneath them. This is exactly why your case file needs a section for prior diagnoses, not just current symptoms. Write down every label you've been given, when you got it, and what evidence it was based on. You're not trying to argue that those doctors were wrong. You're trying to show whoever you see next that these labels may all be describing pieces of the same underlying picture, and that's a very different, very compelling way to walk into an appointment. Let me walk you through what this looks like when someone actually builds the file. Picture someone, we'll call her the composite of thousands of real stories like this, who spent 4 years being told her dry eyes were allergies, her fatigue was just motherhood, her joint pain was old mattresses, and her racing heart was anxiety. For specialists. For separate, unconnected explanations. For dead ends. What changed wasn't a new test. It was that she started writing everything down in one place: dryness, fatigue score, joint symptoms, the swollen gland she'd noticed but never mentioned because it seemed unrelated to everything else. She walked into her next appointment not with "I don't feel good," but with 8 weeks of tracked, dated, specific data across all 5 categories. Here's the part that matters most: the appointment itself didn't look dramatic. There was no single new test, no lightning bolt moment. What happened was quieter than that. The doctor looked at a page instead of listening to a summary, and the page did something a 15-minute conversation never could. It showed frequency, it showed persistence, and it showed the connections between systems that get split up across different specialists. A dry mouth mentioned in passing sounds like a minor complaint. A dry mouth logged 60+ times over 2 months, next to a documented new cavity, next to a fatigue score that never dropped below a 5, stops sounding minor. It starts sounding like a pattern that deserves a specific test, ordered on purpose, instead of a general reassurance. That's the appointment where the word Sjogrens finally got said out loud. Not because the disease had changed. Because the evidence had finally been assembled in one place, for one doctor, at one time. That's what you're building. That's the entire method. I want to address the fear that's probably sitting underneath all of this, because it's a real one. What if you do all of this tracking, you finally get the appointment, and the test still comes back negative? Here's something worth knowing before you even get there. A meaningful share of people who are eventually confirmed to have Sjogrens do not test positive on the standard antibody panel the first time around, sometimes not for years. That's not a dead end. That's a known, documented pattern within rheumatology itself, which is exactly why a case file matters even more when labs are ambiguous. A specific enough symptom pattern, tracked over time, can be enough for a rheumatologist to pursue further testing, like a lip biopsy or specialized eye testing, even when the first blood draw doesn't confirm anything. In other words, a normal lab result is not proof that nothing is happening. It's one data point, in a process that was always going to depend on more than one data point. Don't let a single negative test undo weeks of real, tracked evidence. Bring the file back. Ask what the next diagnostic step is. Keep going. 2 more categories, and these are the ones people almost never think to mention, because they seem too minor to matter. The first, dental and oral changes. New cavities in a mouth that's never had them. Difficulty wearing dentures that used to fit fine. A tongue that looks unusually smooth or red. These are small, but they're gold as evidence, because a dentist noting unusual dental decay pattern, patient reports dry mouth, is exactly the kind of specific, dated, professional note that builds a case file a rheumatologist takes seriously. The second, unexplained lab findings you were told not to worry about. A slightly elevated inflammatory marker. A positive ANA that got dismissed as probably nothing. A low platelet or white count that got filed away. On their own, doctors are right that these don't mean much. But inside a case file that already includes dryness, fatigue, and body-wide symptoms, that probably nothing lab value becomes a supporting witness, not a false alarm. Go back through your old records if you can. You might already be sitting on evidence you didn't know was evidence. I want to take a moment here, because I don't want this to sound like doctors are the villain in this story. They're not. The honest reason this gets missed so often is structural. A typical appointment is built around one complaint, one system, 15 minutes. Primary care doctors are trained to rule out the common, dangerous things first, which is the right instinct. Rheumatologists, who are the specialists who actually diagnose Sjogrens, often only see you after multiple referrals, and by the time you get there, your story has been told in fragments to 5 different people, none of whom saw the full timeline. The diagnostic tests themselves aren't even perfect. A meaningful percentage of people with confirmed Sjogrens don't test positive on the standard antibody panel, at least not right away. Which means this was never going to be caught by one lab draw. It was only ever going to be caught by pattern recognition, over time, across systems. That's not a flaw in you. That's a flaw in how the system is built to look at one piece at a time. Which is exactly why building the full picture yourself, before you ever sit down in that office, changes the entire conversation. So let's make this concrete. Here's exactly what to do, starting today. Get one notebook, or one note on your phone, just one, so nothing gets scattered across 5 different places. Create 5 sections, one for each clue category: dryness, fatigue, body-wide symptoms, dental and oral, and labs and history. For 2 weeks, once a day, spend 90 seconds writing down anything that shows up in any category. Not vague impressions, specifics. Eyes felt gritty by 3 p.m., used drops twice. Fatigue 7/10, slept 8 hours. Left wrist stiff for 20 minutes after waking. Small entries, every day, add up to something no single doctor's visit could ever capture. Pull your old lab results if you have online portal access. Look specifically for ANA, inflammatory markers, or anything flagged as mildly abnormal that was never followed up on. Add it to the lab section, even if a doctor told you it was nothing. When you go back in, don't lead with, "I think I might have Sjogrens." Lead with the case file. Say, "I've been tracking my symptoms for the last several weeks, and I'm noticing a pattern across these categories. Can we talk through whether this could be one connected condition rather than several separate ones?" That single sentence reframes the entire appointment. You're not asking to be believed. You're presenting evidence. If the first doctor still isn't willing to look at the whole file, that's information too. It means it's time to ask specifically for a referral to a rheumatologist, who is trained to look at exactly this kind of cross-system pattern. There's one more piece of this that doesn't get talked about enough, and it's not medical at all. It's the exhaustion of explaining an invisible illness to people who love you but can't see it. You look fine. That's often the hardest part. Nobody can see the grit in your eyes or the fog in your head from across the dinner table, so it's easy for the people around you, even the ones who care about you the most, to quietly start assuming you're exaggerating, or that you'd feel better if you just tried harder to push through it. That's not because they're unkind. It's because dryness and fatigue and joint pain don't look like anything from the outside. There's no cast, no visible swelling, no obvious reason to make space for what you're carrying. This is another reason the case file matters beyond the doctor's office. When something is written down, dated, specific, tracked over weeks, it becomes easier for the people in your life to understand too. It's not, "I don't know, I just feel bad again." It's, "Here's what's actually been happening, on paper, for 2 months." You deserve to be believed by the people closest to you, not just by a specialist. The same evidence that gets a doctor's attention tends to get through to the people at your table too. Here's what I want you to sit with. The average diagnostic delay for this disease exists because the disease is scattered, not because people aren't paying attention, and not because their symptoms aren't real. You just spent the last several minutes learning to see the pattern that most 15-minute appointments are never built to catch. That's not a small thing. That's the exact shift that turns, "I don't know what's wrong with me," into, "Here's what I think is happening, and here's my evidence." You are allowed to be the one who puts it together first. You are allowed to walk into that office with a case file instead of a complaint. And whether the answer turns out to be Sjogrens or something else entirely, you will have gotten there faster, and with more clarity, than almost anyone who waits for someone else to notice first. Start your case file today. 2 weeks from now, you'll either have your answer, or you'll have a document strong enough that no one can wave it away. Either way, you stopped waiting. And that's where this actually starts to change. I know it doesn't feel like it some days, especially on the mornings when your eyes are too dry to open easily, or your hands ache before you've even made coffee, or you catch yourself forgetting a word you've said 1,000 times before. On those mornings, build a case file can feel like one more task on top of a body that already feels like too much to manage. That's fair. You don't have to do this perfectly, and you don't have to do it all today. You just have to start noticing. That's genuinely it. The first entry in your notebook doesn't need to be impressive. It can be one line, "Eyes dry again, fatigue 6/10." That's the whole beginning. The pattern builds itself, one small entry at a time, whether you're paying close attention to it or not. The only difference a case file makes is that you get to see the pattern too, instead of only your body knowing it. And here's the last thing I want to leave you with. Whatever this turns out to be, Sjogrens, something adjacent to it, or something else entirely, the skill you're building right now doesn't go away once you have an answer. Learning to track your own body, to notice the quiet connections between symptoms, to walk into a doctor's office with evidence instead of just a feeling, that's a skill that will serve you for the rest of your life, with this condition or any other one that ever tries to hide in plain sight again. You were never dramatic. You were never making it up. You were just gathering evidence before anyone else was ready to look at it. So go start the file. Today, if you can. This week, at the latest. Not because you need permission to trust yourself, you already have that. Just because now, finally, you also have a method.